Today we're going to be talking about pain in EDS and HSD, and why do people with hypermobility experience so much pain? Hi, I'm Dr. Clair Francomano, and this is my YouTube channel where we talk about all things related to Ehlers-Danlos syndromes and hypermobility spectrum disorders. There are three major sources of pain in people with EDS and HSD, and those are muscular, neuropathic, and myofascial. And the muscular pain comes about because the tendons and ligaments at the joints are not holding up their end of the bargain in supporting those joints because the connective tissue in EDS and HSD is weak. And therefore, since the tendons and ligaments aren't really doing their job, the muscles are stepping up to try to support the joints. And in that process, they can go into spasm, and that causes pain. So the source of the musculoskeletal pain, the muscle pain in EDS and HSD, is muscle spasm related to the joint laxity. Neuropathic pain is pain caused by nerves, and that happens at lax joints when the nerves that travel through the joints are being impacted by the joint elements, the bone that is in the joint, and it's moving around in a way that it's not supposed to, and it can impact on those nerves and even injure the nerves if the joint is very loose. So we have nerve pain related to that. And then the myofascial pain is a particular kind of muscle pain that happens where the muscles interdigitate with the tendons at the joints, and those muscle fibers are interdigitated, or they're linked up with the tendon, and the tendon is lax, so the muscle fibers are trying to hold that joint together, and the muscle, again, we have a muscle spasm, but now surrounding the tendon fibers. And so we have pain at that site where the muscle is connected to the tendon, but for reasons we don't completely understand, the pain can travel through the connective tissue to distant locations, and it causes referred pain. So we may have pain in the knee, for example, that's caused by myofascial trigger points in the thigh. And the knee is what's hurting. It brings the patient to the doctor. The knee hurts. The knee looks fine. X-ray, knee looks fine. Everything is fine with the knee. Might even do an MRI of the knee, and that's completely fine because the pain is coming from a distant location from those myofascial trigger points in the thigh. So those are the myofascial trigger points that need to get released in order to alleviate the knee pain. And there is a map that's available that shows you, if you're having pain in one location, where to look for the myofascial trigger points to alleviate that pain if it is coming from a trigger point. And there is a book by Dr. Clair called the Myofascial Trigger Point Workbook, and that gives a really good description of trigger points and the map of where the pain will travel from specific trigger points, and also some things that you can do at home to alleviate those myofascial trigger points. In general, what do we do about pain in EDS and HSD? The general strategy is to get the muscles to relax and then to tone and strengthen the muscles in order that they will be able to support the joints without causing pain. And those things need to be done hand in glove. So physical therapy, in my opinion, really is the cornerstone of management for pain in EDS and HSD. And you want to find a physical therapist who has experience in managing people with hypermobility and understands the need for both the manual therapy to get the muscles to relax and the toning and strengthening to get those muscles stronger to be able to support the joints. So the manual therapy is going to include things like deep heat, ultrasound, massage, use of electrical stimulation, infrared heat. All of these things will allow the muscles to relax and then enable them to be able to tone and strengthen with movement and exercise. I prescribe a compounded cream that helps with management of these issues. It's made up in a compounding pharmacy. We need a prescription for this, so in order to obtain it, you'll have to find a practitioner who's willing to prescribe it. But it contains diclofenac, baclofen, cyclobenzaprine, magnesium, gabapentin, and lidocaine. Cyclobenzaprine and baclofen are both muscle relaxants. Diclofenac is a nonsteroidal anti-inflammatory. Gabapentin helps with nerve pain, and magnesium helps alleviate muscle spasm as well. Lidocaine is a local anesthetic. So this cream is made up by a compounding pharmacy in a pre-measured pump that delivers 1 gram of cream per pump, and you can use 1 or 2 grams 3 or 4 times a day, depending on where your pain is most severe at any given time. Now, the issue is that a lot of insurance companies are not paying for compounded products anymore, and the good news is that the diclofenac, the magnesium, and the lidocaine are all available over the counter without a prescription. So those are elements that you can use and may be helpful for alleviating muscle pain at any given time. The final thing I'd really like to emphasize is the importance of movement for people with EDS and HSD. Our bodies are made to move, and most of us these days really are not moving enough. So it's really important to try to get at least 30 to 40 minutes of low-impact activity most days of the week. So that would be 5 or 6 days of the week. And what are the low-impact activities? They're going to be things like walking, bicycling, stationary bicycle, elliptical machine, a rowing machine. Any kind of activity that you do in the water is going to be low impact. Aquatic exercise is ideal for people with hypermobility because the pressure, the hydrostatic pressure of the water helps to hold the body together, and you're not fighting gravity when you're in the water, so you're able to do that toning and strengthening work without the risk of falls. And there are a lot of things that you can do in the water. If you don't like to swim, that's okay. You can walk in the water. In the shallow end of the pool, do shallow water walking, or you can put flotation belt on, and in the deep water, do deep water running. There are aquatic facilities that have stationary bicycle or treadmills in the water, and you can walk on the treadmill or ride the bike in the water, and these are really, really great options for people with hypermobility. So that's the first thing in terms of movement. I really, really advocate getting at least 30 to 40 minutes of low-impact activity most days of the week. Some resources that you can find to help learn more about movement with EDS and HSD. One is Jeannie DeBond's Zebra Club, which is available online and has a wonderful program of movement that's specifically designed for people with joint hypermobility. And I would also like to recommend to you Leslie Russick's Hypermobility 101 program. Leslie Russick is a very expert physical therapist who has managed patients with hypermobility for many years, and her Hypermobility 101 program has a wealth of information about EDS in general and specifically about movement in EDS. So that is a brief overview of pain in EDS and HSD. Thank you for spending this time with me today. If you've enjoyed this video, you may like the one that I did on managing dysautonomia, and I wish you the very best on your journey.